What we probably will need to include in the upcoming ESMO guidelines, which are also will be in collaboration with the EHA, are some new data and new agents that will be accessible in Europe. For instance, CAR T cell therapies are now also being approved in Europe, more specifically Brexucabtagene autoleucel or Tecartus is likely to be approved in many European countries for patients who have relapsed after ibrutinib therapy. So this is something that we need to put into the algorithms of our patients with relapsed mantle cell lymphoma. In the near future, we also expect to have data on a number of randomized trials for first-line treatment for mantle cell lymphoma. There's been an ongoing trial called the SHINE trial, randomizing patients to standard treatment with bendamustine and rituximab maintenance, or an experimental treatment including ibrutinib plus BR. And I think we'll see results from this trial, and this is something we need to consider also in the next guidelines. We expect to see results within this year, I think. So this will probably be something that will affect our guidelines. Another thing that we will probably discuss more is what patient that should receive more intensive treatment, especially among the elderly population. We know now that addition of bortezomib improves overall survival in elderly patients with mantle cell lymphoma in the form of VRCAP that is shown to be superior to R-CHOP for the elderly population. So this is also something that we need to put into our treatment algorithms. There may also be new BTK inhibitors approved in Europe, as has been the case in the US. In Europe, so far, we have ibrutinib, but in the US also acalabrutinib and zanubrutinib are approved agents for relapsed mantle cell lymphoma. And we'll see if this will also be the case in Europe. So those are some of my thoughts concerning upcoming guidelines for mantle cell lymphoma. There are a number of new treatments and new data that we need to put into the guidelines, add to the current guidelines.